Good morning. We are about to do a hair loss treatment on my husband. He's behind me here. He is a kind of willing volunteer. I kind of forced him. I figured with COVID, I would do a how-to video of the hair growth treatment. Protocol is in the manual to do one treatment a week for 8 weeks, rotating the two different serums, which I have here. So you have your kit that looks like this. And in your kit, you have 8 treatments. This is for one person. It's not for 8 different people. One person does one kit. In your kit, you have skin rejuvenation, and then you have hair repair. The hair repair is your DHT blocker, and then your skin rejuvenation is your microneedling to strengthen the root, the papilla of the hair. So as we know, microneedling will strengthen and repair and rebuild the follicle, making it deeper into the scalp. However, we cannot prevent the hormone DHT, dihydrotestosterone, from being produced. We can't stop hormones. So what the hair repair is needling in the DHT blocker. So when that hormone does travel into the shaft of the hair, reaching the papilla and weakening it, as we all learned in our theory, when the papilla is being weakened, DHT is what's doing that. So if we can put that blocker into the shaft of the hair, it will prevent the testosterone from changing to DHT and weakening the papilla and reversing the treatment that we've done. So DHT, remember, is something that a DHT blocker is something they will always have to use after treatment, because we need to make sure that dihydrotestosterone does not penetrate into the follicle of the hair, because dihydrotestosterone weakens the root, and that we produce more of as we age, especially in men. So we're going to start today with the hair repair on Rob. I'm going to take some before and after photos. I will do his treatment to protocol once a week, rotating back and forth. I personally, when I do these treatments, I normally recommend doing the hair repair week 1, the skin rejuvenation week 2, and then take 4 weeks off. Use your home care in between the 4 weeks off, and then go again. Week 1, the hair repair. Week 2, the skin rejuvenation, 4 weeks off. That way they're getting a 4-month treatment. This treatment is not cheap. You're going to retail this treatment to your clients for $3,000. That does include the DHT blocker for them to go home with. And then after treatment's done, they will have to continue doing a DHT blocker at home. So we will start. I'm going to do everything exactly to protocol on the way that the treatment was created, but don't be afraid to make it your own. You guys are the professionals looking at your clients. Be willing to kind of work with your clients and be able to do what they need. So today I'm going to do it the way that the protocol calls for, just so you guys can see exact step by step. I'm going to pop out my hair repair. So here's the hair repair here. It is in a glass ampule, so you snap the lid off, you put it on the scalp once the scalp is prepped for it, and then you needle it in. One thing I do like to do, which I won't be doing today, is I do like to get a syringe. You can purchase them at Shoppers and stick it in and syringe out the serum, because I do find it a little bit hard to work with out of the glass ampule, but you can do it out of the glass ampule. Just personal preference, I do like to syringe it out, but today I will be working from the glass ampule. So we're gonna start the treatment here. I'm gonna show you my setup. I'm gonna see, I don't know how to flip my camera around. Maybe I can. I'm gonna see here if I can show you guys my setup. So here I have my setup. So I have my gloves, I have my gauze, I have my needles, I have my face mask, I have my comb, which has been sterilized. Over here, I have my handpiece that is wrapped in a plastic bag. Then I have my machine wrapped in plastic. Then I have a Gibson over top of it. And then I have my Preempt CS20 wipes over top of that. I really like to work from a sterile environment. I have my 70% alcohol to clean the scalp. I also set out here a Ready Medical. This is our growth factor, and it is an amazing, amazing treatment. It is not part of the protocol, but I actually like to add in a Ready Medical here and there into one of their treatments because this is as close as you can get to PRP. So why not do a growth factor halfway through treatment or do it 2 times through their series of 8? It would add on to their cost, but it's going to give them a phenomenal result. So I did put it here to show you guys. Don't be afraid to add in a Ready Medical treatment because it is proven to be the closest thing to the human body on the market as PRP. It is not PRP, but it's the closest thing you can get. So it's a phenomenal add-on. So there is my setup. And now I'm going to start. I'm going to just set my camera here. I'm going to start by cleansing Rob's scalp. Oh, sorry guys. There we go. Okay. I think you guys can see me. All right. We got our light here. Oops. Okay. I might turn that off just for video purposes, but we'll see how it goes. So I'm gonna pop my gloves on. I'm always working from a sterile environment. Rob has come in. He had just had a shower, no product in the hair. Hair is completely clean. It makes my life a little bit easier. You don't want any product because we don't want to be needling any product. We are only gonna be working at a infusion level. We do not need to be working deep into the scalp. So, a 0.5 is max. We never want to see blood with this treatment. We just want to make sure we're penetrating right into the shaft of the hair, into the papilla. So I'm cleaning my gloves first with a 70% alcohol. Then I grab my gauze. And because his scalp is clean, and I've asked him before he came to really thoroughly clean his scalp, we should be good to go. And you're just needling him, right? So it's his dander, it's his cells. So it's not really the end of the world because we're not going to be working to blood. But I've soaked a gauze with 70% alcohol and I'm really going to get in there. Normally I like to work with a spray. You can buy the spray, 70% alcohol in a spray bottle. But of course today, when I'm going to do the video, I can't find my spray bottle. So today we will work with a gauze. Normally I would just spray and then take the gauze and really cleanse. We are only working the thinning areas. Rob is starting to thin in the front of his scalp and a little bit in the back. He is almost 40, so the thinning process is perfect. Remember, we cannot treat somebody who is bald. If the follicle is completely damaged or dead, we can't bring it back to life. So make sure a thinning hair is the perfect hair to start treating. Somebody who's thinning or starting to lose. So somebody in their late 30s, early 40s is starting to see some hair loss. So they are like the perfect clients to start treating. Women as well, we do produce testosterone, and as we age, we produce a little bit more. So we never really, well, some women do lose their hair completely, but most women just thin out. Just put some alcohol in my hands there because I wasn't really getting the result that I wanted. I really want to get the hair nice and saturated with alcohol because then that way the hair is wet and the serum I'm going to put on will not absorb into the hair. It's going to absorb into the scalp. And it's okay if it does absorb into the hair because it will penetrate down the shaft, but the closer I can work to in the scalp, the better. I highly recommend using a spray bottle, not a bottle like this, but it's all I had at the moment. So 70% alcohol to cleanse and make sure the scalp is sterile. So now is when I'm going to take my after photos, because when the hair is a little bit more wet, you can really see the thinning. When it's dry, it's hard to see the thinning. So as you're taking your before and after photos, make sure you take your after photos after the alcohol is applied or when the hair is wet. So you can really see the change. Your before photos, sorry, not your after. But when you do your afters, make sure the hair is wet as well, because you don't want people to think that you're doctoring your photos. This treatment really does work. And if they think you're doctoring it, you're not going to get any clients and they won't trust you. So I have wet the scalp. I'm really in the thinning areas. I'm going to take my gloves off because I'm going to go and touch my phone. I'm going to pause you guys here just because I need to take my photos, and then I will come back. Okay, so I've taken the before photos. Now I'm going to put new gloves on. It's a very easy treatment to do. Again, I'm going to cleanse my gloves just in case. Cleanse my gloves with a 70% alcohol. And now I've got my needles here. Remember, you've got your sticker on the back to prove that everything is sterile and top quality. So make sure you peel that off and stick that in their chart. I'm going to open up my needles here. Got my needles. Put that down. Grab my handpiece and screw in. Make sure you go in straight. Lately I've been struggling with that. And now, again, if you're doing this treatment, you've been trained in microneedling by myself or by somebody on our team. So my gauge here, I'm going to start Rob at about a 0.4, 0.5. You know what, I'll start him at a 0.5 and see how we do. If there's any pinpoint, some people do pinpoint at a 0.5. So make sure if you see blood, you turn it down. You don't want to see blood in this treatment. I've got my speed set to 150. I've got my foot pedal here. I'm turning up to 150. There we go. Put the gauze in my hand. And what did I do with, oh, my ampule. I'm going to set my handpiece down for a second. A little bit ahead of myself here. Now, due to COVID times, we would always be wearing a mask. This is my husband, so I don't have to wear a mask. So I'm going to pop these on. I've just touched my hair. Unfortunately, I'm going to clean my hands again. Normally that would be on beforehand because of COVID. But before COVID, I always recommend with these treatments to wear a mask. It's way more professional. If you're talking to your client, you don't want to take any chance of any saliva or any of your DNA going on your client. It's just not pleasant. I've got my comb here that's clean and ready. And then I've got my ampules. So I'm going to snap my ampule, step back on my trolley, client tips head down, and I'm only working the thinning areas. So I'm going to put 1, 2, 3, 4, 5, 6 drops, set my ampule down, pick up my handpiece, wrap so the cord doesn't go all over them. And I work the same way I would for microneedling, as I work in circular movements. I'm going a little bit slower on your client. You would never numb the scalp because there's no need, A, and B, you'd never get it out of the hair. So again, I'm piercing the scalp 150 times per second. I'm not seeing any blood on Rob, so I know I'm at the right depth. I grab my ampule and I continue on. A few little drops in the thinning areas. And now I continue to needle in. And I see I'm dripping. And this is why it's nice when the hair is wet, because it's not absorbing into his hair, it is absorbing into his scalp. I like to do them sitting up so that if they were laying down, the product would go all over the place and it'd be running down his face. Sometimes it still does when I get to the front of the scalp. And Rob's quite tall for me, so I might have to get on my tippy toes so I can really see where I'm working. Thank you. So remember, more aggressive in microneedling, a lot of times people think is deeper needles. That is a myth. That's actually bad. That's putting the skin, creating more inflammation, a longer downtime. The slower you go, the more puncture wounds you're creating. Because remember, you're creating 150 wounds, atraumatic wounds, per second. So if I slow down and I stay in one area for 2 seconds, guess what? I've just created 300 wounds. Why you never want to stay on an area for a very long period of time. As you can see, it's very simple to do. And a really good treatment to be offering right now, because clients need to be wearing a mask. So this is something we can do, because if Rob was not my husband, he would have to wear a mask right now, and it doesn't affect anything. How you doing, Rob?
Great.
Does it hurt?
No.
How would you describe it?
I wasn't prepared for questions. It feels like maybe like an aggressive comb.
Aggressive comb?
Yeah.
Okay, perfect. Rob doesn't have really long hair, so normally I would use a comb, but I don't need to with him because his hair is so short. So a really aggressive comb. Treatment 1, they might not be as sensitive because the scalp carries a lot of debris, especially if they use like Head and Shoulders, or they use a shampoo that's like an anti-dandruff, because it can clog the pores. So you've got to break through all of that first. So treatment 1 normally, well, not normally, sometimes isn't as sensitive for people. Treatment 2, you might find pinpointing at a 0.5, so always make sure you watch. Just because you did a 0.5 on them this time doesn't mean you'll be doing a 0.5 on them next time. So Rob's major thinning areas are right at the front of his crown. So we're really going to apply some extra DHT blocker there to make sure everything is absorbed. Remember, with microneedling on the skin, our skin only absorbs 7% of product. On the scalp, it's going to be even more because there's so much dead skin cells. We don't treat the scalp the same way we treat our face. We have hair protecting it. So you are going to get a much higher percentage, 200 times more of product absorbing into the scalp. which is going to be great because if you're using a shampoo for hair loss or a DHT blocker or anything like that, without microneedling, you're not getting a 200 times absorption. You're only getting, at max, is a 7% absorption, and I highly doubt that with the amount of debris and buildup that the scalp can hold. I'm just doing a once over. Bigger circles are more comfortable. You want to make sure you don't miss any spots. And that's it. Done. I'm going to turn off my machine. And now I take, while my gloves are on, I like to pull up my plastic over my needles, give a twist. And then I like to remove the plastic, set my handpiece down onto my Preempt 20 hospital grade disinfectant wipes. My needle goes into the sharps bin. My sharps container is over there, so I'm not going to do that. I dump it in, and then I throw this in the garbage. So for right now, I'll just tie that up. And he's done. So I'm going to tell him no hats, no helmets, no anything on his scalp for 48 hours. And keep the hair and area clean. He has his DHT blocker to start doing as of tomorrow night. That he'll put on every night, and he needs to use a home roller as well. So, Eddie? Okay, Eddie's going to join the video so we don't hear him bark. So what's going to happen is he's going to, as of tomorrow, start putting his DHT blocker on. The scalp will feel maybe slightly tender, a little bit irritated, nothing major. But he shouldn't be in like severe pain, but just tender to touch, almost slightly bruised. And then within a couple days, he'll be fine. Probably within tomorrow, he'll be fine. Then he'll start using his DHT blocker, and up to 3 times a week, he will home roll, but I'm going to see him in a week. So I'm not going to tell him to do it 3 times a week right now. I'm going to tell him to do it once, and then I will see him next week. Today is, what is today? Thursday. So next Thursday, hopefully I will see him again for treatment number 2, and he will have put his DHT blocker on every single night with 1 home roll to guarantee that 80% absorption, because remember, a home roller creates an 80% absorption in the scalp or on the face. So he'll home roll many directions into the thinning area, put his DHT blocker on, and then that is going to give a high absorption while doing treatment, and then after treatment as well. So that is the end of the treatment. Your client is good to go. There's no blood. He's fine. He's not in a lot of pain. I'm going to see him next week for treatment number 2, and then we go from there. Okay, so that is your hair loss treatment. Thanks for watching, guys. If you have any questions, please don't hesitate to shoot me a text, give me a call, or send me a message on here. Bye.